Hi friends, welcome to my YouTube channel. My today's topic is lichen planus. First of all, I want to say that this is not a detailed class of lichen planus. However, this note is just a concise version specifically prepared for AFK. For those who want little more elaborate class, you can comment me. Let's start. This is a chronic inflammatory lesion that affects the mucous membrane inside the mouth, which comes under the category of red and white lesions, specifically under immunopathologic disease. We all know that the other immunopathologic disease is lupus erythematosus, which we will discuss later. The etiology is not known, but the pathogenesis is clear. The primary role for the pathogenesis of lichen planus is immune system. Histopathology characteristic of subepithelial band formed dominated by T lymphocytes and macrophages. Also, degeneration of basal cells can be seen. That is called as liquefaction degeneration. So these histopathologic characteristics shows that expression of cell-mediated arm of immune system being involved in pathogenesis of oral lichen planus through T lymphocyte cytotoxicity, which directed against antigens expressed by the basal layer. This oral lichen planus seen mostly in women, especially 55 years of age. Next is the clinical features. To memorize easily, you can remember as RPPBEU. So there are different forms of lichen planus are there. The first one is the reticular form. So this reticular form is that can be seen as fine white lines or striae, like this. So this striae most frequently seen in the buccal mucosa. So this question has asked in AFK, so that it is really very important. And rarely this oral lichen planus can be seen on the mucosal side of lips and sometimes on the vermilion border. And the second variety of oral lichen planus is the papules type. So this present in initial phase of the disease, which can be seen as small white dots intermingled with reticular form. Then the other type is the plaque-like form. This is a homogeneous, well demarcated white plaque surrounded by striae sometimes. It is like a homogeneous well demarcated plaque, so that this has little similarity towards homogeneous oral leukoplakia. And the other one is the bulbous type. This is unusual, so I'm not going to explain detail about that. The next is the erythematous. This erythematous can be seen as a homogeneous red area. We know erythema is a redness. And striae frequently seen in the periphery. But in some patients, this homogeneous red area exclusively in the attached gingiva. So sometimes this kind of disease can be misdiagnosed as discomitative gingivitis. So histopathologic observation is required. Then the last variety is the ulcerative type. This is like fibrin coated ulcers surrounded by erythematous zone, displaying white striae. The first three, like the reticular form, papular form, then the plaque-like, so these three are asymptomatic. So the patient may just have the feeling of roughness. So this is the clinical feature of oral lichen planus. So we have to be thorough with this. Next is the clinical manifestation. Cutaneous lesions on trunk and flexor surfaces of arms and legs. You all know that must have heard about Koebner phenomenon. That is, a relief following intense scratching of lesions, but this trauma may aggravate the disease. And this lichen planus can be seen under genital mucosa also. Next is the pathology that is really important. Questions asked, especially in AFK, that is area of hyperkeratosis, often with thickening of granular cell layer. This hyperkeratosis is really important. That hyperkeratosis can be seen in the histopathological feature of the lichen planus, and the saw-toothed appearance to retapex. Then, as I mentioned earlier, liquefaction degeneration, then the eosinophilic band beneath the basement membrane. The management is primary treatment of choice is topical steroids, and secondary treatment of choice is cyclosporin. So only this much is required, this much of information related to this topic is required for AFK. I hope this class would be helpful, and don't forget to mention the feedback in the comment section. If you are interested to study more, please like my video and share this to your friends too. Thank you.